Speaking.
Well, I'm calling from Dr. Garris' office.
Oh, okay.
The reason I'm calling is that we received blood work results, and she wanted to make sure that you either reviewed them with her or if you had Care Connect or Healthy Life to review them that way.
Yeah, so these are blood tests she had asked for, or Dr.
Yes.
Diane from Virtual Clinic asked for?
We wouldn't have gotten them if she didn't request them, but...
The thing is, though, didn't I already do these from April?
That I'm not sure of. I just get the message to call, so if you don't want to follow up with her, if you've already you said another doctor to follow up with?
So what I'm confused about with your office is that the notes that I got, right, in my medical file, is she wrote something different in the file that you guys have access to than the letter she responded to me with. And this is inconsistent, and it's confusing me, and it's confusing other people when I say I kind of fired her and I don't have a medical doctor. I'm wondering if even 811 will call me, because maybe 811 will think that what her notes are accurate.
No, they would know that you've self-discharged. That's fine. The reason she wants to follow up is because she was the ordering, and she doesn't want that to go missed. So that's all. So if you don't want to, that's totally up to you.
So what I'll do is I'll read you what I'm talking about, so you can answer the question I just asked there. Do you have the time to do that?
Well, I'm not sure it's relevant, because it's either a yes, you would like to talk to her about results, or a no.
Okay, so what's relevant for me is to try to find out if outside of myself people think I have a medical practitioner or not. I can tell.
No, because we actually got a call from the lab today, and they said that you had dropped off a sample for the fit test. And they were thrown because the records show that you don't have her as a doctor. And they said, well, do we still test it because he doesn't have a doctor?
Yeah, so they told me they removed her today per my request, right?
Which they also told us. So that is confirmed through my colleague that she has spoken with them as well.
So
this is just so she does her due diligence. She received the results. She wanted to follow up with it if you would like. But if you do not want that, that is up to you.
So this is very important because I'm struggling with this right now, and I may lose employment, and I'm still trying to get my medical done. So does she believe she is my doctor? Because the notes that she wrote after receiving my letter that fires her is that she believes she's told me that she will be available for me until I find a doctor. That's her notes. It's not what is written on...
That is the standard note that's written, and that is because they don't want you to be without someone. So there's generally a timeline that they would give, and I think it's either 3 to 6 months. It depends on the reason, so that if there were things like medication renewals or things that you absolutely needed and you couldn't reach a virtual care. The thing is, now that there's a virtual care option in the hospital, the ER and everything, it's hopefully that you don't need it, but I mean, that's kind of...
You do know I can't do a medical at virtual clinic, right?
Yes, I am aware. And you can't do it at the hospital either.
I can do it at the hospital? I've done it before at hospitals.
You cannot do it at the hospital.
Can you explain?
They won't do it. So we've had patients go up looking for driver's medicals and different work medicals, and they will not be able to do it.
Where do they end up getting it?
I don't know.
Is her opinion that she still can't pass me on a medical for her assumptions?
Well, she wanted you to do some other testing, right?
Yes, based on her assumptions, right? Yeah.
If that's not something that you're comfortable with, that's your prerogative, right?
Well, I'm not comfortable with being asked to do things that isn't scientifically, explained, right? That she asked me to do something that for me, I don't even know if she has shares in this company. Like, I've never had a doctor ask for this before.
No, she does not.
So I need to know kind of why she asked for this and why it's not happening in time and why she believes she's a good doctor.
Remind me, was it for a sleep study that she was sending you?
Yeah.
Yeah. So sleep studies and blood work and all those things often go with the driver's medical because they have to be able to say, oh, this person isn't going to fall asleep at the wheel.
Yeah, so I've done many medicals before and nobody's had that opinion of me.
And,
She's the only one.
I'm not sure of why. So again, I wasn't privy to that conversation. That's not my business, right? I'm not here to speak to that, and that's up to her as a physician. So I have seen other physicians in our practice have requested that for some patients, depending on the need, for sleep study for driver's med. So it's not unheard of, is what I'm saying. That's all.
Yeah, so the other thing is, why isn't my letter and her letter included in the file? Like, because I know you guys know how to scan, because you scan my, vaccine passports, but though
So
that
it's
information
in
is
our
not.
file,
Yeah.
but our files are different than the hospital files.
What hospital files? You guys gave me on the USB both the virtual clinic and your files of my.
So we would provide you reports that were done, and the report for the driver's medical was not done. So we could not provide that part to you.
Okay,
but
so
everything else we gave
yeah,
you.
so maybe I don't know if you're multitasking, but you don't seem to be answering my questions. My question is, when I reviewed the 59 pages that somebody from your office, I don't know if it was you, gave me on the storage device, I noticed, even in beautiful color, that you guys had scanned my vaccine passport that I handed in there. But you guys did not choose to scan the letter where I fired her and her response. That is not included in the notes, and I'm wondering if that...
Well, so I don't know if I was the one that did that filing, but the reason we wouldn't have scanned that is because usually if it's a letter from you, you're aware of it.
Okay.
And the other letter was mailed to you.
That's the reason it wasn't
that would
included.
be why they weren't attached. Again, I don't know, because I'm not sure it was me. I don't even think it was, but
yeah.
Either way, we gave you your chart.
Okay, can you kind of tell me how to reach the owner of that clinic?
There isn't like one specific owner. They all own it together as a practice.
Oh, I was told one time there's one owner by one of your staff there.
Okay.
Okay, so
what do you need to speak to them about?
Well, I mean, don't you think I have a lot of things to speak to them about, or?
Well, it's all perspective. I don't know what answer you're expecting to get from this person.
Well, I'm expecting answers. Like, I want to know why.
And you're not giving me an answer either. So you say I'm not answering your questions, but I'm asking you a simple, do you want to follow up with her or no?
Okay, so here you kind of didn't answer the question, then you said I didn't answer the question. So
well,
what?
You said I didn't answer questions, so why can't I say the same to you as me?
Yeah, but the question that I'm not refusing it, I'm just trying to get more information from you. If it's very important for you, like I told the lab person at the hospital, is it's important now that I did it to just process that test. If something is positive in that test, of course she can call me. But I also asked you guys, didn't I do all these in April? Because I would not have refused to do these. So.
Well, I don't think the lab would have given you the fit test again to do because they're very particular. So if you'd already been given one, they would have said, nope, we already gave you one back in April. So the blood work, maybe it was ordered by another doctor and the lab may not have known that she wasn't your doctor anymore, so they would have CC'd her, but I don't see that here. So again, I'm working on the assumption that it is from the original ordering, and same for the fit test, because they wouldn't be able to, like the blood work they could do again if some other doctor ordered it, but the fit test was specifically her that ordered it, right?
Yes, I was suspicious because the virtual clinic doctor did not, to my knowledge, ask for that. But then I'm not sure that the blood tests I did reflect what he... I mean, it's possible the lab won't even admit, and I'll find out later, that they didn't do the exact test this latest virtual clinic doctor from June requested. It could be that they processed again the request from Garris from a few months ago. So...
I mean, it's possible, but I highly doubt it.
Yeah, but the thing is I seem to be the only one among virtual health representatives to want to not live my life by assumptions. I actually have a life skills lesson that lasts 4 or 5 hours based on identifying assumptions. I offered it for free at the RCMP because I was a victim of their assumptions as well, and they also refuse. So it's kind of hard to kind of wonder who the law-abiding person is, who the patient or the healthcare profession is sometimes when I interact with all this employed people kind of covering each other, even when, sometimes they're not even related.
Yeah, I don't really know what you're looking for.
Well, I'd like answers, and I can't get some from you or from Garris, so can the owner...
If I have answers, then you're not happy with my answers.
But you're giving me assumptions when things can be verified, so they're not assumptions anymore. And I don't want to live by assumptions. I don't want to accept assumptions as answers.
I don't have endless time to, debate this with you.
So your question was...
So do you want a follow-up phone call or not?
Well, if something shows as positive, of course I do. That's why they tried to give the test back to me. I said, no, I already did it.
So
what if it's positive for the first time? Of course you got to...
I haven't received the fecal test yet, so I don't know what that one is. The results for the blood work, I cannot say over the phone because I am not a qualified physician, right? So I can't give you that. She wants to follow up with you. Sometimes it's just to tell you the results are good. Sometimes I'm not sure, right? So I'm just the messenger.
I already know about the blood
tests.
tests.
A phone call or not?
I already know about the blood tests because I looked them up on Healthy Life, and there was just a slightly low coverage for coagulation, and it could be because I take 81 milligrams of acetylsalicylic now. I'm not sure, but it's very low, so the virtual clinic doctor...
I mean, you know your stuff better than I do for that. I have no clue, right? So that's why I'm saying if you have already reviewed it, great. If you would like something from her to, if you change your mind and you do want to follow up, just give us a call, okay?
If something is positive, yes, she can call me back. But I already know about the blood test that is 0.8 and not in the range of 0.9 to 1.1. I already know about that. But the fecal matter one, if it's positive, yes, of course, she should do her due diligence. Now, do you have any idea...
She can review that, okay?
You don't have any idea of the other things, but do you have any idea about who I can contact that is, let's say, the manager or the ownership of your clinic? The main person.
You could email our clinic, and we could forward that to the head.
Okay, and how will I know it's the head that's seen it and answered? Because they'll sign their names, or are they some sort of anonymous person?
So I will pass it along to them. I'm not sure what's going to happen with it.
Okay, do you have my email?
Do you have ours? Let me see if we have yours. We have drhumanics@gmail.com.
Yep.
But if you can email us.
But why do you need me to email you when I don't have internet at home?
I can then forward that person.
But you can already do that unless that person kind of is not within your abilities to contact. Just say, hey, can you email Martin and, try to give him a time?
They won't do it that way. They won't. If you're not willing to put that request out, they're not going to do it. You could go to the library and use a computer there.
Okay, are you able to email me so I know what your email is? And then I'll put...
Email.
Yeah, so you can't email me. You have to give it to me.
Well, I can give it to you over the phone.
Yeah. We're almost at the stage where patients have to do their own blood test.
It does take extra time for all of those things.
Yeah. Okay, so what is the email of the person in charge that will answer me?
So this is the email for the clinic, and we will forward it to the person in charge.
Okay.
Give a pen.
Well, I'm recording now, so I'll just listen to the recording after.
So it's I'm giving you the phone number. The email is the number 2, the letters ND, so it'll be the short form of second, the short form of avenue, AVE, the short form of medical, MED, the word clinic, and then at gmail.com.
Well, thanks for being clear. I will do that at some point after I finish some other homework. Thank you very much.
Okay, thank you.
Bye-bye.